Dear friends, today we are going to discuss about another question from Usmle Embryology. A 1-year-old girl presents to the pediatrician because of the increasing neuromuscular irritability and tetany over the past few weeks. She has also had recurrent viral and fungal infections since birth and was born full term. Results of the physical examinations are within the normal limits. X-ray of the chest reveals the absence of the thymic shadow. Thorough laboratory testing reveals a T lymphocyte deficiency. So what are the findings are most likely in this child? So they just say that there is no thymus gland. So thymus gland is responsible for the T cell maturation. So the deficiency of the T cell, because of that the patient is suffering from recurrent infections and neuromuscular irritability. So the cause of, we have to find the cause of neuromuscular abnormal irritability. So for that we need to know that from where the formation of the thymic gland. So the thymus is formed from the third pharyngeal pouch. So before that we need to understand that there are different sort of pharyngeal pouches and different sort of structures that are formed from these pouches. So we have there are 6 pharyngeal pouches, while the fifth one, it doesn't give any sort of structure. So the first one, second pharyngeal pouch, third, fourth and sixth pharyngeal pouch, they are responsible for the formation of various structures of your face and your neck. So some points about the pharyngeal pouch is that the pharyngeal pouch is lined outer side the ectoderm, endoderm, and middle there is the mesoderm. And every pouch has its own blood supply, its own nerve, and its own cartilage, like we can see in all the pouches. So the area which is evaginating and it's going outside, that is the pharyngeal pouch. We can say that is the pouch that is from the future pouch, and the area which is going inside, that is the groove. So different structures are formed from the groove and different structures are formed from the pouches. We will not go through the structures which are forming from the first pharyngeal pouch, second pharyngeal pouch, and fourth and sixth pharyngeal pouch, but our main point or main focus will be the third pharyngeal pouch. So what are the structures they are formed from the third pharyngeal pouch? For that we have here an image which from where we can understand the structures. So before the development of thymus, I just want to say something that in the previous video we discussed about the thyroid diverticulum, that the thyroid diverticulum is formed and through the thyroglossal duct it come down to its original position. Is there, if there is some developmental defect, then definitely thymus will not, the thyroid gland will not come down, then that condition is called as ectopic thyroid gland. And if the remnant or if the thyroglossal gland persists, that is called as the thyroglossal duct cyst. So we will not go through in detail of all these things, but mainly I want to tell something that the second, third and fourth pharyngeal pouch, from the outside it invaginate toward the inner side and it form combinedly a cyst, and that is called as the cervical vesicle. And from the inside the third pharyngeal pouch, it form a structure like this, and this structure give different sort of structures. So from the upper surface of, or the upper part of this pouch, it give rise to our thymus, sorry, the inferior parathyroid gland. From the upper area it give the inferior parathyroid gland, while from the lower area it give thymus from the lower area. And what about the fourth pharyngeal pouch? It gives the superior parathyroid gland. We have a 2 pair of parathyroid glands. So the 2 pair from the third pharyngeal pouch and 2 pair from the fourth pharyngeal pouch. So our main focus will be on the third pharyngeal pouch. So they say that this patient, this 1-year-old girl, she don't have thymus. It means that she's suffered from developmental defect of the third pharyngeal pouch. So once the third pharyngeal pouch is not formed, then definitely the thymus will not form. The thymus will not form mean there is no T cell maturation, mean there is deficiency of the T cell. So the person will susceptible, or the person will prone to different sort of infections. Okay. And what is the other structure from the third pharyngeal pouch? There is the two pairs of the parathyroid gland. The parathyroid gland is responsible for the production of parathyroid hormone, and this parathyroid hormone is responsible for increasing the calcium level. So definitely once there is no formation of the parathyroid, then there is no level increase in the calcium. So this patient will suffer from hypocalcemia, and there is calcium is very important for the muscular activities. Calcium is very important for the neurological physiology. So if there is no pharyngeal pouch, that is the third, so there will be no thymus, there will be no parathyroid gland. With that, the patient also suffer from different sort of other associated conditions like some cleft plate and cardiovascular anomalies. So we have a structure here that what are the signs of this patient, that it may have low nasal bridge, small head, epicanthal folds, flayed midface, smooth philtrum, thin upper lip, underdeveloped jaw, small eye opening. So associated sign, they are the cyanosis due to cardiovascular anomalies. There is the cleft plate because of the failure of the fusion of the pair of the maxillary prominences with that of the medial nasal prominence. Once they fail to fuse, then there is opening remains there, and that is called as the cleft plate. And there is facial anomalies, different sort of structures that form from the third and fourth pharyngeal pouch. So they are not formed, so then there will be anomaly into the facial structure, and there is difficulty learning. So all these points about the Digeorge, and this condition what we call is Digeorge syndrome. So this patient is suffering from Digeorge syndrome. Associated cause, so what will be the associated cause? That there is deficiency of T with low level of calcium. So elevated parathyroid hormone, no, because parathyroid is not forming. Enlarged thymus, there is no thymus. Enlarged thyroid don't have any relation with the third one, third pharyngeal pouch, that form from the midline or from the thyroid diverticulum. Low calcium and low serum phosphorus, so the best choice is low calcium level because of the lack of parathyroid gland. Thank you for attention.